I'm happy to introduce our first speaker for today's workshop, Dr. Andrea Knight. And Dr. Andrea Knight is a pediatric rheumatologist at the Hospital for Sick Children in Toronto, Canada. She conducts research with the goal of improving mental health and quality of life for young people with rheumatologic conditions. And so the stage is yours. I will stop sharing my screen and let you share your screen. Thank you for speaking today.
Okay, hi everyone. Thanks for having me, Natasha and Isabel, at this really nice workshop. And thanks everyone for waking up and being here on a Saturday morning. I'm just looking in the chat for a second. Okay, so let me share my screen. Okay, and we will put it in a presentation mode. All right, can people see presentation mode here or the other mode?
The other mode.
Okay, what about now?
Yep.
Okay. All right. So basically for the next half an hour, we are going to be, I think it's half an hour, hopefully. But Natasha cut me off if it's not quite that long. We are going to be chatting hopefully about a lot of the things that seem to come up in these initial questions. And I am hoping that this is as interactive as possible, as much as people feel comfortable. If you're not so comfortable, it's totally fine. But if you're comfortable, definitely feel free to chime in. So as Natasha introduced, I am a rheumatologist, a pediatric rheumatologist at Sick Kids, the Children's Hospital. And I've been doing a lot of work on mental health and brain health for our patients with rheumatologic conditions. So you're already familiar with Menti, so I can keep going past this slide. So for our discussion today, I wanted to first talk by talking generally about mental health, and then go into what we're finding and what we know about the relationship between mental health and rheumatologic conditions. And I encourage you to think about it in a very individualized way, because it's not the same for everybody. And I think we'll realize that as we're going through. And then we'll begin to talk a little bit about steps or approaches that we can think about to help take care of our mental health. Okay. So first, really thinking about like what is mental health. We had the word cloud, which I think brought up some really great thoughts about what mental health is. And you can see from these pictures here, mental health might mean different things like meditation to some people, getting enough sleep, maybe eating healthy, maybe exercising, maybe more of a medical sense of mental health. But it's really important to think about mental or emotional health as a part of our total health. And I know in the comments, one of our participants already said mental health is everything, and definitely related to all the other aspects of health that we think about. So whether it be physical health or social health, emotional health is very critical to those things. And we can also think about health on a little bit of a spectrum. So I found this very helpful schematics, actually. I think it's on a University of Ottawa website. And so, physical health, we can think about, okay, on the left side, we're sort of in the green zone, we're balanced, maybe we're feeling healthy. And then maybe, if we're not feeling as physically well, we're feeling a bit stressed in the yellow. Maybe in the orange, we start to feel like we're struggling. And in the red, we see like, okay, we're having a crisis. And the same is true for mental health. So you can think about mental health along a spectrum, right? You're usually not quite going from, the left side to the red side, but you have a sense of balanced mental health, and maybe moving into stressed mental health at times, struggling at times, and crisis mode. And I think, what we're trying to avoid is getting into that crisis mode. So thinking about this spectrum, how can we identify mental health on the spectrum and think about how to get ourselves closest to that green side, closest to the left side. So we can think about positive mental health on the left side when we're in this yellowish green zone. And we might feel like we're enjoying life, we're connected to others, and we can face problems that come our way because we know that problems are going to come. It's part of life. Negative mental health, though, on the other end, is when we're in this orangey red zone. Some days we may feel happy and confident, but other times we might feel very sad or anxious, overwhelmed, maybe avoiding others, having difficulty doing things that we regularly would want or need to do, or that we could do and need support. And that would get worse as we get into crisis mode. The other things to think about is, when we think about mental health, it encompasses the three things on the right, like, so the thoughts that we're having, like, how are we thinking? Also the behaviors, how are we acting? And emotions, how we're feeling. So I think a lot of times people tend to focus on emotions as sort of mental health central, but it's also important to think that it's the thoughts and behaviors that come along with that as well. Okay, so Menti question. In the spirit of sort of recognizing where we are maybe on that spectrum and thinking about our stress levels, I'm going to ask you to indicate on their Menti, how do you think your stress levels have been in the last month? So Natasha, you can feel free to share. I guess I'll stop sharing my screen.
Sounds good.
Okay.
The same code as before as well, so it's been sent in the chat again, but if you guys still have it open, I think you can still use it.
Okay, so we may have some responses still coming in. But what we're seeing is many people with a moderate level of stress. Some people with high, one person with very high, one person with low. But in general, we're seeing a decent amount of stress, which I think, is really important to think about and recognize, for ourselves. If anybody is comfortable, you could definitely put in the chat any thoughts about what you think might be contributing to stress. So, for example, we are at the beginning of the school year, for example. So maybe there's some stress related to school, work, exams, school and getting accommodations. Okay. Exam season. Thank you for volunteering in the chat. There might be other things contributing to stress. So, sometimes there's things going on in your family. Sometimes there's things going on with your condition. So somebody wrote flare-ups in the chat. Another person wrote midterms. So these are, I'm seeing some commonalities and trends in terms of what might be leading to stress. But I think one of the first steps to being able to manage stress and address stress and mental health is just thinking about it. And I think often sometimes we don't allow ourselves to think about what might be stressing us and how much it's contributing. So I have another comment: midterms and lots of papers, school and getting around very hard, especially treatment not working, and multiple times, and that is stressful. Thank you for sharing that. And sports and school mixture. So it sounds like a little bit of managing time between different activities as well. Okay. All right, so let's go back to the slides. Let's see. All right, so I'm going to skip over this because we did a word cloud, but this is just to show you the types of things that patients with juvenile myositis, for example, so a rheumatologic condition. I'm not sure which conditions we have represented here in the participants today, but these are the types of things that were contributing to mental health or poor mental health for some of these patients. So interestingly, just to point out, it's kind of similar to the word cloud we just generated, I think, with anxiety being very, very prominent in this word cloud. So thinking about mental health in the context of rheumatologic conditions, one of the things that I think can be helpful to think about is, over the course of diagnosis, how do things change in terms of mental health? So you can imagine maybe at the time of diagnosis, many young people are wondering, well, what is happening to me? What is happening to my body? How's this going to affect my body? How am I going to cope with this? How is my family going to cope? And what does this really mean for my future? And I think what I've learned in taking care of young people with rheumatologic conditions is that it seems to be really a bit of a roller coaster, in that there's highs and lows, and it varies over time. And it really depends on what's going on in an individual's life. So not just with the rheumatic disease, but also with the other things that everybody just volunteered in terms of school, in terms of trying to do activities, maybe not feeling up to activities, maybe not being able to fit them in, also related to the disease itself. So just to share with you, one of the studies that was done to look at how emotions might vary over time. This was a study that had participants with juvenile arthritis. And what it was looking at is what are the different emotions and feelings over time from the time of diagnosis and through the course of having the condition. And so you can see what was noted was before diagnosis, many patients said that they had an anxiety, a fear, a confusion. They weren't sure what was going on with their body. And then at diagnosis, there was some thankfulness of having a diagnosis, but it was very mixed with feeling kind of shocked, like, oh my gosh, like, what are you telling me? Some disbelief and some fear, really not knowing, like, what does this entail? What's going to go on over time? And you can see it's followed by these ups and downs. A lot of times the ups are characterized by the patients in this study as feeling, having sympathy, having gratitude and sympathy and feeling like they're doing well. But then when and this was really correlated to when the disease was quiet. So feeling, much more mentally healthy when the disease was quiet, but certainly at the time of increasing symptoms, having trouble with mental health and struggles with mental health. And this was all sort of shaped by having an underlying anxiety or feeling like being not in control of things because of the condition. And I wanted to show you, this is more in the words of patients. So this is from some patients with juvenile myositis, and it was described as the JDM roller coaster. And, again, it really illustrates the range of feelings over time that were reported by patients with juvenile myositis. And, in the beginning, you can see there was a lot of back and forth to different doctors. And then around the time of diagnosis, feeling like, okay, they have a name, someone knows what it is, and they have a proper condition, but also feeling like, well, there's not really a cure. So what does that mean exactly? And I'm not going to go through all of the, quotes and words here, but I'm hoping that some of you can relate to, these different aspects of mental health. And again, I'm not sure exactly what conditions are represented here. and even where you are in your journey, with having a rheumatic condition. But I thought it would be helpful to illustrate that, many patients do struggle with mental health over time, but there are times when things are better. And I think trying to find an approach to maximizing the amount of time that we can spend in the mentally well arena is really important. Okay. So one of the questions that we get sometimes is, well, how common are mental health problems in our young people with rheumatologic conditions? So we know from studies that have been done across different conditions like juvenile arthritis and lupus and juvenile myositis and others, that about 1 in 3 of our patients will have depression or anxiety. This is thought to be higher than healthy peers. So I apologize. I don't know why the stick figure in the blue, the head is always cut off, I gotta say, on my slides that I present, and that's not intentional or meaningful in any way. But it's just to say that, I think sometimes the depression and anxiety, it may or may not be higher than in your peers all the time. But I think even if it's similar in terms of proportions or rates to healthy peers, I think, patients with rheumatic conditions, they have a lot going on. They have a lot of extra stuff to manage besides what maybe their peers have who don't have a rheumatic condition. And importantly, the studies have also shown that really not a lot of the patients have actually had mental health evaluation. And we'll talk a little bit more about what that might entail. And I also wanted to draw to the attention that, when we think about mental health and mental health disorders, it's not just depression and anxiety. There's other things that fall into that category. So I think it's really important just to be aware that this includes things like eating disorders, things like substance-related disorders. So, alcohol abuse, for example, and other drug-related abuse. So there are many potential factors that can affect your emotional health. We've gone over some of these, but just to sort of put it in a diagram form, you have starting from the left on the bottom, there's different limitations that can go along with different rheumatic diseases. So physical limitations due to arthritis, due to muscle weakness, due to pain, which is our second category. But limitations can also pertain to interactions with family and friends. So feeling fatigued is something I hear that limits people from really having social interactions and going out with friends. And also limitations in terms of school. So, not feeling well, feeling fatigued, having flare-ups, even having to miss out on things because of appointments, for example. There's limitations there. Pain is another big contributor to emotional health, as are stigma. So stigma can sort of happen in a couple of ways. So one is what we call visible stigma. So, if you, for example, have rashes or visible signs of having a rheumatic condition on your body, it can really make you feel sometimes isolated, I think, and that can affect your mental health. But there's also this concept of invisible stigma. So meaning that maybe you don't have a lot of outward signs on your body in terms of rashes or scars or other changes, but just the fact of having a rheumatologic condition that usually is kind of rare, maybe not many people have heard about at all or understand. And then also maybe like within yourself and your own family, it's not something that is typically heard of or known in the general population. So having to explain the condition and then also deal with the isolation that can come along with that can definitely have a toll on mental health. There's also the sort of stress of managing a chronic disease. So many of the patients, including yourselves, may be on multiple medications that required to take several times a day, or maybe the medications are injections that can be, you know, very not pleasant to be taking. And there's sort of this idea of complexity of care. So maybe you're seeing a rheumatologist, but you're also seeing an ophthalmologist, and maybe you're also seeing a cardiologist, and you're seeing all of these ologist people that make your life quite busy and stressful trying to manage it all. There's the uncertainty that we talked about in that roller coaster diagram, not knowing what's going to happen with the condition in the short term, especially, but also in the long term. So, you know, sometimes we get questions about, well, what does this mean for me? Maybe if the patient is younger, what does this mean for me going to college? What does this mean for me being able to work later? What does this mean for me to be able to have a family? These are questions that maybe a lot of young people who don't have rheumatic conditions don't have to think about so much. But I think that there can be stress in thinking about these questions, maybe at a very young age, for patients with rheumatic conditions. So one of the other topics that came up in the chat is relationship to the actual rheumatic disease. So there's thought that there is some relationship between inflammation going on in general in the body and how that might affect the brain function and how that might affect emotional health. So there are some studies that are not necessarily in patients with rheumatic disease, but these studies are showing that levels of inflammation in the body are thought to be linked to things like depression and linked to things like anxiety. So we're just really starting to try to tease this out in pediatric rheumatology, but that's something certainly that we think about. There's also the background of parent and caregiver well-being that can contribute to emotional health for patients. So thinking about like, well, how is my caregiver doing with all of this? That can have a toll on the patient as well. And then, you know, there's things like heritability. So these are things like genetics. So for example, you know, if there's a strong family history of things like depression and anxiety, that can put a patient at risk, not necessarily definite to develop depression and anxiety, but put that patient at higher risk for all of these other things contributing to depression and anxiety, for example, as well. Just to speak a little further to the complexity, and that was another word that I think came up in our previous polls for today. There's a lot of complexity here because, you know, the diagram I showed just the slide before has these neat little boxes and like things are contributing in these boxes. But this sort of overlay, which is I borrowed from one of another pediatric rheumatologist had made this slide. This is in the context of lupus, but I think it's very applicable to really all of our diseases, thinking about how so SLE stands for lupus, for those that don't know. On the left, you have things that are maybe thought to be more directly related to the rheumatic condition, so pain, fatigue, maybe having some trouble concentrating. And then you have these mood disorder symptoms that very much overlap. Sadness and anxiety. And then you have things like medications that can contribute also to mental health challenges. So particularly steroids, for example. Steroids can cause mood changes, but also other things like weight gain and acne and appearance changes that can be very stressful. And then there's the concept of adjusting to having a new diagnosis. So just to illustrate that there's a lot of overlap here in complexity, and sometimes it's very hard to actually tease out, you know, what are the main contributors. I'm going to pause here and see if there's any questions or comments that are arising, but I can't. Let me see if I can see the chat.
I can check the chat as well. do have one question. So it's how do you I can't say this word. How do you differentiate, my apologies, between mood disorder symptoms secondary to the rheumatic disease versus another psych disorder such as anxiety, ADD, etc.?
So that is a really great question and a very challenging one, and something that is actually a big challenge from the day to day for me as a pediatric rheumatologist, and I think for many of my colleagues. So one of the things that we do try to think about is, okay, let's say somebody is coming to clinic and they are having a really tough time with sadness and depression. We do try to think about, well, how much is this related to, could this be related to the rheumatic condition? So typically lupus, for example, is one that is known to cause direct effects on the brain. So we do think about that. But then we also have to think about, well, okay, maybe if the lupus isn't particularly active, maybe this depression is not due to lupus, but could it be due to side effects of medication? So are they on steroids? Let's see how that's affecting them, for example. Or maybe is this a more recent diagnosis? And let's talk about how they might be coping with this new diagnosis and whether some of the sadness might be related to that. The other thing that comes up, and I think this is what the question is getting at, is this idea of, could this be depression that's not at all related to, let's say, the lupus or the medication or adjusting to the diagnosis? And that's something that we consider as well, but it's very challenging and there's not an easy answer. One of the things that we really do try to do is to get some other expertise. So we will often ask our psychologists or psychiatrists to weigh in and help us to tease things out. Because in the end of the day, we want to make sure that the way that we address any mental health concerns is specific to the patient and what's going on with that individual patient, and be the most effective that it can be. But it's definitely challenging. So we have another question. Okay, so the comment is, so when I had a moon face, which is a very common symptom of being on prednisone or steroids, I didn't feel confident in my body, and I took steroids for my lupus, and it changed my mood, but I never realized the correlation. So that actually, thank you so much for volunteering that comment. So it is really important, I think, for yourselves as patients, or if we have any caregivers on, to be aware of these different contributors to mental health and stress that we're talking about. And so perhaps I will move on to my other slides, but I love this discussion. So, we talked about these things that contribute to mental health so far, but I also wanted to point out that, just in the words of patients, we were able to do some survey work with patients with different conditions. And so this is responses from young people with juvenile myositis. And they were rating how these different aspects of having their disease relate to their mental health. So the higher the bars, the higher the impact on mental health. And we asked patients in the blue, and we also asked parents about what they thought about their own children. So it's interesting here, if you look across all of these different factors that were brought up by young people with juvenile myositis, the patients rated the impact higher, right? You see the blue bars they're kind of higher than what the parents rated. So I think, the impact on young people that they perceive is generally, fairly high. And you can see a lot of the things that came up already, I think, in our questions and our Menti questions. So worrying about a flare was the top, stress on the family, changes in appearance, physical limitation, worrying about the future, limits on outdoor activities, and feeling like they were growing up too fast. So a lot of parallels between what we already talked about, but also some differences that were really volunteered by the patients themselves. So we won't spend too much time on this, but I think it's important to recognize that mental health and emotional health, while it's very important to quality of life, so that's in the blue and sort of how you're feeling day to day, it also is important to how you're interfacing with your condition and the healthcare system. So there's been studies, both in young people and adults, that are showing that if mental health is not as good as we can make it, there's implications for being able to be in control as much as possible of the disease. And that's not always possible, and that's definitely not always related to mental health. But you have your sort of like your best opportunity if the mental health is really optimized. Also, how you utilize healthcare can be impacted by mental health. So there's some studies showing that if the mental health is not as good, perhaps there's more visits to emergency room and more visits to hospitals and more visits to even clinics. And then, at some point, there's a transition from pediatric to adult care. And there's been studies that have shown that this can be impacted in a negative way if mental health is not as good. We know that there's impacts on school performance and later work productivity and generally peer and family relationships. So these are all really important things, and all reasons to really think about how to optimize our mental health. Okay. These are some other things that were from the words of patients. So mental health can affect just ability to take medications, keeping up with appointments, doing well at school, relationship with the family, keeping up with friends, and just becoming an adult. Okay. I think we might skip this question in the interest of time, unless people really, really want to answer. But I do feel like we've had a lot of thought and responses already on this. What do you think, Natasha?
Yeah, I think we could skip it. And maybe if we have time, because we do have more questions in the chat already. So
Oh,
so
yeah.
maybe we skip that for now.
Okay. Okay. So this is again from a survey that we did with some patients, not only with juvenile myositis, but I'm just showing you a snapshot here. And we asked them to tell us, what have they been actually diagnosed with? So you see in the orange bars that, it seems like many, about a third, as we said in the beginning, have been diagnosed with anxiety and depression. Some of them, about 20% almost, with anxiety disorder, some with thoughts of self-harm, as you see, some eating disorder, and some other. But what was striking is that we asked, well, are there some of you who have been having symptoms but not yet diagnosed? And we see the additional amount in the blue bars of patients that think that they are struggling with these symptoms but haven't been diagnosed. So we think that a lot of our mental health symptoms might be under-recognized. Okay. And from that same survey that we did, we wanted to ask, well, what's your comfort level with talking to different types of providers about mental health? So again, we have the patients in the green bars and the parents in the blue bars. And the further to the right they are, the more comfortable they are. And you can see all these different providers, from psychiatrists down to rheumatologists at the bottom and social worker at the bottom. So what you see in general is that the parents seem to feel more comfortable raising mental health concerns than the young people themselves. Perhaps not surprising, but I think an indication that there's some work to do to make things more comfortable. And if we looked at, well, which provider are they most comfortable with, it seems to be the rheumatologist, and maybe their family doctor, maybe a psychologist at the rheumatologist office if that is available. But of note, all of these different types of providers could potentially help with mental health. So I think, many patients are most comfortable with the rheumatologist probably because they see them the most, I would think, even more than their family doctor. But it really signaled that rheumatologists and perhaps family doctors would really have a big role here. When we asked them what were the top barriers to seeking mental health care, it was that mental health providers don't understand my disease. Maybe they've never heard of it. Maybe they don't know what goes along with it, along with things like cost and time. So just to point out, in the mental health, in the rheumatology clinic, because I suspect, again, many of you probably go there, maybe more often than you would like, but pretty frequently. So, providers in rheumatology can be there to check on your mental health, can be there to help get help when you might need it, and also can help you to feel better overall and take care of the mental health. The rheumatologists are often maybe a first contact point, but I encourage you to think about, when you're at rheumatology clinic, how it might go. So often you might be talking to a nurse first. They might be asking you, taking your vitals and saying like, okay, how are things going? If you have a good relationship and you feel comfortable with the nurse, it's okay to say, I'm really stressed out right now. I have exams, or if there's something else going on, you're really worried about, a flare, it's okay to talk to, whoever you feel comfortable with at the rheumatology clinic. So again, this may be the nurse, it may be your rheumatologist, it may be a social worker if you're able to access that kind of provider at your rheumatology clinic. There may be psychologists, there may be adolescent medicine doctors. So it all depends on the individual and sort of who you have access to. But I think the point is there's many opportunities that we would want you to feel comfortable about. Psychiatrists may or may not be so accessible, and it may depend on the severity. But one of the points I want to make here, sometimes people think, well, if I have a mental health problem, then I have to see a psychiatrist. But it's not true. There's all these other people that can help with different things, including a pediatrician or family doctor as well. Okay. And talking about these things early is best because we want to really get on top of things before we get into the orange or red zone. So when you're feeling stressed is the time to start exploring those feelings and trying to talk to people and see, how you can take actions to stay in that green and yellow zone. So here I just point out that, one of the things that's happening in pediatric rheumatology across North America is that we're trying to get better. We're trying to get better at helping our patients be able to identify things that are stressing them out, identify symptoms of depression and anxiety. And these are just some studies that have gone on to really show that, the pediatric rheumatologists, we are thinking this is important and we want to be better at screening for depression and anxiety and being able to have conversations with our patients. And then, as we discover through questioning and screening what mental health challenges there are, there's many different options. So again, it's not just straight to psychiatry and medications. There's options for stress management and mindfulness, diet, exercise, and sleep, peer support groups, and talk therapy, some of which you'll be hearing about in these workshops. So this is just to say that, again, we're operating across the spectrum, trying to stay in the green and yellow zones. One of the last things I'll talk about is an effort that, we're doing in pediatric rheumatology to offer something called cognitive behavioral therapy. This is to patients with lupus to help with pain and depression and fatigue. This is a remotely delivered program over Zoom to help patients who are struggling with those things through a 6-week program to help improve those symptoms. And we found that it has helped improve those symptoms as well as medication adherence, and has some early signs of even getting disease activity to be better. So just to say that there's work that's being done, and many people are actively working on this. So perhaps we'll do some questions for this last few minutes, Natasha.
Yeah, that sounds good. Do you want to do the mentee questions or do you want to answer the Q?
Sure.
Up to you.
Maybe we can do the mentee questions, and it might pick up on some of the Q&A questions as well.
Sounds good. Okay. So it's the same code and everything. I think our tech support can also put it in the chat again if needed. But hopefully everyone has access to this.
So I'll stop sharing and then. So maybe as we have some responses coming in. So one of the questions of the chat was, do we set up patients with social workers or counselors, especially during the transition period? So I would say this is probably variable from clinic site to clinic site. Ideally, if I had the resources and I could make my hospital give me what money for whatever I wanted, I would absolutely have that. I would have all of our new patients from the get-go hooked up to social workers and counselors. And people, they may not need it, but they may. And as we saw, there's a bit of this roller coaster. And so I think it's just helpful to know who's available from the beginning, so that if you do find yourself having a stressful period, or the family is having a stressful period, you kind of know who to go to, you know who's available, and maybe it doesn't seem so much of a hurdle. So I would say probably most sites are not in a place from a resources perspective that every single patient can see a social worker or counselor from the beginning, but that's absolutely what we're striving for. Okay. So what has been helpful to help with mental health? So counseling and CBT, talk therapy, and medications. Being outside and being around people who make me laugh and who are supportive, so that connection. Going outside and being helpful, talking to my dog. Yes, I understand that talking to your dog. Organizing everything to help me not feel as stressed or anxious, and a therapist for years. So these are all great things that you're sharing. And I think it really points to also how individual this is. I think different things are helpful for different people. And part of it is sort of getting to know not just what's stressing you and not just what your feelings are, but also how you maybe best will respond to different things.
Okay, do we want to go to the next question?
Okay.
This is an interesting question.
This is an interesting range of responses. So what I'm seeing is, I'm trying to put this together. So there's some aspect of maybe people not understanding the condition and what it entails, and not being willing to understand is sort of what I'm getting. And that it looks like, can negatively impact, or this whole feeling invalidated. So I'm definitely seeing and not being around people who are not supportive. So that's very, I think, helpful to recognize, who's not being supportive, and how sometimes you can try to help that person understand, for example, but sometimes they may not, you might not be able to do that. So there might be a role for really building up the positive interactions and the positive supports that are there. And then there's other things like not sleeping enough. So sort of maybe more routines and recognizing, what is too much, sort of physically and mentally, and how that ties together. Hearing bad news from the rheumatologist, that's a tough one, because unfortunately there are going to be times when there's going to be bad news, and I think that's where, for us as pediatric rheumatologists, we need to be better at providing supports, perhaps, when we have bad news. I hope I'm not missing others. And my boss, yes, those are maybe represents more sort of everyday challenges, but that can feel overwhelming when you're dealing with a lot of other stuff. Right. These are all, thank you so much for sharing these thoughts.
I think we also have some questions in the chat, so maybe we can just take one or two before we wrap things up, if that works.
Sure.
So the first question that I saw is, how can we educate ourselves and our family members about the cultural aspects of mental health to foster empathy and support? Because I think someone mentioned that addressing mental health within the context of culture can be challenging because of the stigma. So how do we navigate that conversation with our family, if you have any tips?
Yeah, so that is definitely a big challenge. It a little bit depends, I guess, on the individual context and in sort of what the culture is. I think in some ways, one of the things that I've seen work and be helpful is if there is a connection within the culture that can perhaps be that support and validation to the patient, and maybe help communicate to, if it's to other family members or to other people within perhaps the community that maybe are not understanding the mental health piece. Sometimes that can be very helpful. But I would say that the first step is feeling like you have sort of individual validation of how you're feeling. And that may be, with a counselor or a social worker, and then using that support to help to communicate with the family or the community where there might be an impasse in understanding the mental health piece of things. So it's a little vague without knowing a specific context, but I think in general that I've seen be a helpful approach.
Okay, awesome. Does anyone have any questions that they want to ask before we wrap things up? Feel free to raise your hand and your mic, put it in the chat. What other options are there when many fail biologics? When many biologics fail, with them not working, it does things to my mental health.
Yeah, so a big challenge, right? When it seems like on the one hand, we have like so many medications that frankly we didn't used to have about 15 years ago. But we're not that great at knowing which medications are going to work for which patients, actually. So I think that this is a big problem and challenge that's ongoing. Um, I think that I don't have a magic wand to be able to say, here is the biologic that's going to work. But I would say, because it is more of a trial and error at times, and that's just being very honest and transparent, I would say even more of a reason to really have that mental health support on board. So to not, hopefully not be in a position where there's like overt depression or really crippling depression or anxiety, but to recognize that, and even for the rheumatologist to recognize, like, this is kind of stressful, right? Like if you're on your third biologic or whatnot, and to really have that mental health support to help just articulate and talk about these feelings and sort of get it out there, because that in itself may not be the resolution, but that really is the first step to processing these emotions and this disappointment and all of the fear and the anxiety that goes along with failed medications, because I think it's a real thing that we don't have medically a great solution for at this time.
Okay, perfect. Thank you so much. So if anyone else has any other questions, you can still put them in the chat. I'll probably send them over to Andrea, and maybe we can get some answers from her, and I'll circulate the answers back because I know a lot of people did have questions. We just don't have much time left. But thank you so much for speaking today. Do you have any last thoughts or words you would like to say before we pass it on and take a break?
Just thank you so much for participating. I wish we had more time to have, more in-depth discussion. I think the main thing I would say is, take time to be in touch with your mental health, allow yourself to feel and sort of take that stress gauge that we did at the beginning, think about what's contributing, think about the things that maybe can be made better, and realize the things that maybe are not quite tangible right there that can be made better, and recognize that even having mental health supports early on before you're in crisis mode can really hopefully be helpful and help to work through especially some of those things that can't be readily changed right away.